You know, as we get a little older, our bodies start to send us different kinds of messages. Sometimes they're just little whispers, like an ache that wasn't there before, or feeling a bit more tired than usual. We often brush them off, thinking it's just part of getting older. But what if some of those messages are actually really important signals? Signals that our body is trying to tell us something significant is happening, something that needs our attention. It can be tough to think about, maybe even a little scary. But ignoring these signals can mean missing the chance to make changes that could truly impact our health and happiness down the road. It's a painful reality that many people wait until something major happens before they start listening. But it doesn't have to be that way. There's a kind of secret in understanding these signals early. It's not about worrying or being afraid. It's about being empowered. Knowing what to look for gives you the power to act, to talk to your doctor, to make small adjustments in your life that can make a world of difference. In this video, we're going to look at 5 important signs that are surprisingly common as we age. Signs that a lot of people overlook. And we'll talk about why paying attention to them is so incredibly important. These aren't scary predictions. They're simply nudges from your body, pointing towards areas where you might benefit from a little extra care and attention. Stay with me until the very end, because I'm going to share something that might genuinely surprise you about these signs and what they mean for your well-being. Let's dive right into the first sign, something that can sometimes creep up on us so gradually we barely notice it happening until it becomes quite significant. This first sign is a noticeable, unexplained change in your weight. Now, I'm not talking about a pound or two fluctuating here and there. That's perfectly normal. I mean a significant loss of weight without trying, or sometimes a significant gain. Let's focus first on the unexplained weight loss, because this is a sign that really warrants attention. When you start losing weight without making changes to your diet or exercise routine, it can be a signal that something deeper is going on within your body. It could be something as simple as changes in appetite due to medication, or it could be related to more complex issues involving digestion, metabolism, or even underlying health conditions that are using up more energy than usual. Think about someone you know, maybe a friend, or even yourself, who just seemed to start getting thinner without changing how they ate. Perhaps they said, "Oh, I'm just not as hungry," or "Food doesn't taste the same." While these might seem like minor complaints, they can be pieces of a larger puzzle. A decreased appetite that leads to weight loss could stem from dental problems making eating uncomfortable, or changes in taste and smell perception which dull the enjoyment of food. It could also be linked to digestive issues where nutrients aren't being absorbed properly, or conditions that cause chronic nausea. More seriously, unexplained weight loss can sometimes be an early indicator of conditions like thyroid problems, diabetes, or even more serious illnesses that affect how the body processes food and energy. Ignoring this kind of weight loss isn't just about looking thinner. It's about the potential loss of muscle mass and overall strength. Losing muscle, which we already tend to lose a little of as we age, can impact your mobility, your balance, and your ability to do everyday tasks independently. It can leave you feeling weaker, more fatigued, and more vulnerable to falls and injuries. If you find yourself or a loved one dropping pounds without trying, it's crucial not to just accept it as part of getting older. It's a signal that needs investigation. So what can you do about it? The first and most important step is to talk to your doctor. They can help figure out the root cause. It might involve simple dietary adjustments, like increasing protein intake or trying different types of nutrient-dense foods that are easier to eat and digest. Sometimes, addressing dental issues or reviewing medications can make a big difference. It might require tests to check for underlying health conditions. The point is, unexplained weight loss isn't something to ignore or celebrate. It's a health signal asking for attention. Being proactive here can prevent a cascade of other health problems linked to poor nutrition and loss of muscle mass. Now, while less common as a stark warning sign in this context compared to unexplained loss, significant unexplained weight gain can also be a signal worth noting, especially if it's rapid or accompanied by other symptoms. Weight gain can sometimes indicate hormonal imbalances, fluid retention issues, or even side effects from medication. Again, it's about a change that doesn't align with your lifestyle habits. If you're gaining a significant amount of weight and you haven't changed how much you eat or exercise, it's also a good idea to mention it to your doctor. It's another way your body might be trying to tell you something is off balance, but focusing back on that unintended weight loss, because it's often a more direct signal of potential underlying issues. Think about the energy you need just to get through the day, to walk around your home, to prepare a simple meal, to enjoy time with grandchildren. That energy comes from proper nutrition and maintaining muscle. When weight is lost without explanation, that essential foundation can be eroding. So, the actionable step here is clear. If you or someone you care about is losing weight without trying, make that doctor's appointment. Don't delay. It's not about vanity. It's about health, strength, and maintaining your quality of life. This first sign, the unexplained change in weight, particularly loss, is a powerful indicator that shouldn't be dismissed as just getting older. It's a call to listen to your body and seek understanding. Now, let's smoothly move on to our second sign, which is often closely linked to the first in ways you might not immediately realize. And that's persistent, overwhelming fatigue or a profound lack of energy that wasn't there before. So we've talked about how unexplained weight change can be a significant signal. Now, let's look at the second sign that often goes hand in hand with it, or appears on its own, and that's persistent, overwhelming fatigue, not just feeling a bit tired after a busy day, but a deep, bone-weary exhaustion that doesn't seem to go away, even after rest. This is another signal your body might be sending that something needs attention. Think about how much we rely on our energy levels to enjoy life, to go for a walk, to meet friends for coffee, to work in the garden, to play with pets, or pursue a hobby. When energy dips dramatically and stays low, it impacts everything. You might start saying no to things you used to enjoy. Finding even simple tasks feel like too much effort. This isn't just inconvenient. It can lead to social isolation and a decline in overall well-being. Why does this happen? Persistent fatigue in older adults can have many causes. Some relatively simple to address, others more complex. It could be related to nutritional deficiencies. If you're not getting enough essential vitamins and minerals, your body doesn't have the fuel it needs. Iron deficiency, for instance, is a common culprit and relatively easy to test for and treat. Vitamin D deficiency, also widespread, can contribute to fatigue. Sometimes, it's related to sleep problems. Maybe you're having trouble falling asleep, staying asleep, or experiencing restless sleep due to conditions like sleep apnea or restless legs syndrome. Waking up feeling unrefreshed day after day will certainly lead to persistent fatigue. Other causes can be related to medication side effects. Many common medications for blood pressure, cholesterol, or pain can cause fatigue. It's always worth reviewing your medications with your doctor to see if any could be contributing. Chronic pain itself is incredibly draining, physically and mentally, and can lead to persistent fatigue. And of course, underlying health conditions such as thyroid problems, heart issues, kidney disease, or even the beginnings of an infection can manifest as profound tiredness. Mental health also plays a huge role. Depression and anxiety are significant contributors to persistent fatigue, and they are conditions that absolutely can and should be treated. Ignoring persistent fatigue is like driving with the engine warning light on in your car. You might keep going for a while, but eventually, something is likely to break down or perform poorly. Chronic exhaustion makes you more susceptible to illness, increases your risk of accidents because you're not as sharp, and significantly reduces your quality of life. It can make you feel older than your years and limit your independence. So, what actionable steps can you take if you're experiencing this kind of fatigue? Again, talking to your doctor is paramount. Describe exactly how you feel, how long it's been going on, and what makes it better or worse. They can run tests to check for common causes, like anemia, thyroid issues, or nutrient deficiencies. They can also review your medications. Beyond the doctor's visit, consider your lifestyle. Are you getting enough quality sleep? Maybe implementing a regular sleep schedule, creating a relaxing bedtime routine, And ensuring your bedroom is dark and quiet could help. Look at your diet. Are you eating balanced meals with plenty of fruits, vegetables, and lean protein? Dehydration can also cause fatigue. So make sure you're drinking enough water throughout the day. Gentle exercise, counterintuitively, can sometimes help boost energy levels by improving circulation and mood. But it's important not to push yourself too hard when you're feeling drained. Starting with short, easy walks can be beneficial. It's important to distinguish between normal tiredness and persistent, debilitating fatigue. If you're tired because you stayed up late, that's normal. If you're tired all the time, no matter how much you rest, that's a signal worth investigating. Don't just chalk it up to old age. While energy levels might naturally shift a bit over time, profound, persistent fatigue is not an inevitable part of aging and often has a treatable cause. Addressing it can bring back vitality and the ability to fully participate in life. It's about reclaiming your energy so you can continue doing the things you love and maintain your independence. Listening to this signal is an act of self-care and can prevent a significant decline in your quality of life. Now that we've covered unexplained weight changes and persistent fatigue, let's move on to a third sign that can be particularly concerning if left unaddressed: significant changes in memory or cognitive function. We've explored how changes in weight and persistent fatigue can be significant signals from our bodies. Now, let's turn our attention to a third area that many people worry about as they get older, and that's noticeable changes in memory and cognitive function. It's true that minor forgetfulness, like misplacing your keys or forgetting a name occasionally, is a normal part of aging. Our brains change over time, just like the rest of our bodies. But when these changes become more frequent, more severe, or start impacting your daily life, it's a signal that shouldn't be ignored. What kind of changes are we talking about? It's more than just occasional forgetfulness. It could be difficulty with tasks that used to be easy, like managing finances, following a recipe, or navigating familiar routes. It might involve trouble with problem solving, making decisions, or planning. You might notice difficulty finding the right words, repeating questions, or becoming confused about time, place, or people. Sometimes, changes in mood or personality can also be part of cognitive decline. It can be frightening to notice these changes in yourself or a loved one. There's a natural tendency to want to ignore it, to hope it will just go away, or to attribute it solely to stress or lack of sleep. However, just like the other signs we've discussed, significant cognitive changes are a signal that needs attention. They could be caused by many different things, and not all of them are irreversible or indicate a serious long-term condition like Alzheimer's disease or other dementias. For instance, cognitive changes can sometimes be caused by treatable issues like vitamin deficiencies, especially B12, thyroid problems, infections like a urinary tract infection, dehydration, side effects from medications, or even sleep deprivation. Depression and anxiety can also significantly impact memory and concentration. In some cases, a minor stroke or other vascular issues affecting blood flow to the brain can cause sudden or gradual cognitive changes. The painful reality of ignoring these signs is that if there's a treatable cause, delaying diagnosis means delaying treatment, which could potentially reverse or slow down the decline. If the changes are due to a progressive condition, early diagnosis allows for access to treatments, support services, and planning for the future. Early intervention can help manage symptoms, improve quality of life for both the individual and their family, and provide strategies for coping. Ignoring it means losing valuable time when interventions could be most effective. It also puts the individual at higher risk of accidents or making poor decisions if their judgment is impaired. So, what can you do if you notice significant memory or cognitive changes? The most crucial step is to see a doctor for a thorough evaluation. Don't go in expecting the worst. Go in seeking answers and support. A doctor can perform cognitive assessments, order blood tests, and potentially recommend brain imaging or referral to a neurologist or specialist. They can help identify potential causes and recommend appropriate steps. Beyond medical evaluation, there are actionable steps you can take to support brain health. Keeping your mind active is key. Through reading, puzzles, learning new skills, or engaging in mentally stimulating hobbies. Social interaction is also incredibly important for brain health. Staying connected with others provides mental stimulation and emotional support. Regular physical exercise benefits the brain by improving blood flow. Eating a brain-healthy diet rich in fruits, vegetables, whole grains, and healthy fats like those found in fish and olive oil is also vital. Managing chronic conditions like high blood pressure, diabetes, and high cholesterol is essential, as these can impact brain health. And addressing sleep problems is crucial. As poor sleep significantly affects cognitive function, noticing cognitive changes can be distressing, but viewing it as a signal that prompts proactive steps is empowering. It allows you to seek understanding, explore potential causes, and implement strategies that can support your brain health and overall well-being. It's about taking control where you can and getting the right support when you need it. Dismissing these changes can rob you of the opportunity to intervene effectively. It's a sign that asks you to seek help, not to hide or feel ashamed. Being open and proactive about cognitive changes is a sign of strength. Now, moving on from how our internal functions and minds signal us, let's consider how our physical presence and interaction with the world might reveal a fourth important sign that shouldn't be overlooked: a loss of interest in activities and social withdrawal. We've talked about physical changes like weight and energy, and cognitive shifts like memory. Now, let's look at a fourth significant sign that often manifests in our behavior and our engagement with the world around us: a noticeable loss of interest in activities that were once enjoyed, and a tendency towards social withdrawal. This isn't just wanting a quiet evening instead of going out sometimes. This is a sustained pattern where someone stops doing things they used to love and starts spending much more time alone, often declining invitations or avoiding social situations. Think about someone who used to be the first one on the dance floor, or who loved attending club meetings, gardening with neighbors, or spending hours on a hobby. If that person suddenly stops doing these things, seems listless, or consistently prefers to be alone instead of connecting with others, it's a powerful signal. This change in behavior can be subtle at first, maybe missing one or two events, but over time, it becomes a clear shift towards isolation and apathy. Why is this a warning sign? A loss of interest and social withdrawal are classic indicators of depression, which is unfortunately common in older adults, but often goes undiagnosed and untreated. Depression is not a normal part of aging, and it's far more than just feeling sad. It's a medical condition that affects mood, energy levels, sleep, appetite, and interest in life. If someone has lost interest in activities, it could also be due to physical reasons, like pain or mobility issues making it difficult to participate, or fear of falling preventing them from leaving home. Changes in hearing or vision can make social interaction challenging and frustrating, leading people to withdraw. Cognitive changes, which we just discussed, can also make social situations confusing or overwhelming. Ignoring this sign has significant consequences. Social isolation and loneliness are major risk factors for both physical and mental decline in older adults. They are linked to increased risk of heart disease, weakened immune systems, cognitive decline, and even premature death. When you stop engaging with hobbies and social activities, you lose opportunities for physical activity, mental stimulation, and emotional support, all things vital for healthy aging. The painful reality is that withdrawal can become a self-reinforcing cycle. You feel low and withdrawn, which leads to more isolation, which makes you feel even lower. What can you do if you notice this in yourself or someone else? Again, communication and seeking professional help are key. If you're experiencing this, try to articulate how you feel to a trusted family member, friend, or your doctor. If you notice it in someone else, approach them gently and express your concern from a place of care. Encourage them to talk about how they're feeling. Seeing a doctor is important to rule out physical causes like pain or sensory impairments, and to screen for depression or cognitive issues. Depression is treatable with therapy, medication, or a combination, and effective treatments can restore interest in life. Actionable steps beyond medical consultation involve making a conscious effort to reconnect, even in small ways. This might mean scheduling regular phone calls or video chats with friends and family. It could involve joining a senior center, a hobby group, or volunteering if mobility allows. Finding adapted activities that accommodate physical limitations can help. For instance, if walking is difficult, maybe a seated exercise class or a book club is an option. Setting small, achievable goals, like attending one social event a week or spending 15 minutes on a former hobby, can help break the cycle of withdrawal. It's about taking small steps to re-engage with life and people. It's important to remember that losing interest and withdrawing isn't a character flaw or something to be ashamed of. It's a signal, often of underlying issues like depression, physical barriers, or cognitive challenges. Addressing it is crucial for maintaining emotional well-being, mental sharpness, and overall health. It's about staying connected to the world and the people who bring joy to your life. Recognizing this sign and taking action is incredibly important for living a fulfilling life as you age. Now, let's move on to the fifth and final sign we'll discuss today, one that directly impacts your ability to move confidently and safely through your environment: changes in mobility and balance. So far, we've explored signs related to our internal health, energy levels, and cognitive and emotional well-being. Our fifth and final sign today focuses on something very visible and practical: changes in mobility and balance. This could look like increased unsteadiness on your feet, shuffling your gait, needing to hold onto furniture more often, difficulty getting up from a chair, or, perhaps most significantly, experiencing falls or near falls more frequently. Maintaining mobility and good balance is fundamental to maintaining independence as we age. Our ability to walk safely, to get around our homes, to go out and do errands, or visit friends depends on it. When mobility becomes challenging or balance deteriorates, it directly impacts your ability to live life on your own terms. It's a signal that your physical foundation might be weakening, and it absolutely must not be ignored. Why do changes in mobility and balance happen? They can be caused by a variety of factors, often interconnected: muscle weakness and loss of muscle mass, sarcopenia, which is accelerated by inactivity and poor nutrition, linking back to our first sign, directly impacts strength and stability. Joint pain and stiffness from conditions like arthritis can make movement painful and difficult, leading to a more cautious or altered gait. Nerve damage neuropathy can affect sensation in the feet, making it harder to know where your feet are placed. Vision problems can make it harder to navigate obstacles and changes in terrain. Certain medications can cause dizziness or affect coordination. Underlying health conditions like Parkinson's disease, stroke, or even ear infections can affect balance. Fear of falling itself can lead to reduced activity, which in turn weakens muscles and worsens balance, another self-reinforcing cycle. Ignoring changes in mobility and balance is incredibly risky. The most immediate and serious consequence is an increased risk of falls. Falls are a leading cause of injury among older adults, often resulting in fractures like hip fractures, head injuries, and other serious harm. A fall can lead to hospitalization, loss of independence, chronic pain, and a significant decrease in quality of life. Even if a fall doesn't result in serious injury, the fear of falling can be debilitating, leading to reduced activity and social isolation, which then contribute to overall decline. The painful reality is that ignoring these initial wobbles can lead to a fall that fundamentally changes your life. What actionable steps can you take to address changes in mobility and balance? First and foremost, discuss these changes with your doctor. They can assess your risk of falling, review your medications for potential side effects, and check for underlying medical conditions. They might recommend physical therapy, which is incredibly effective in improving strength, flexibility, gait, and balance through targeted exercises. A physical therapist can create a personalized exercise program tailored to your specific needs and limitations. Beyond professional help, there are many things you can do. Incorporating exercises that improve strength and balance into your routine is vital. Simple exercises like standing on one foot while holding onto a counter, walking heel to toe, or leg strengthening exercises can make a big difference. Even gentle activities like Tai Chi or yoga have been shown to improve balance. Make sure you're getting enough protein in your diet to support muscle health. Review your home environment for fall hazards. Things like loose rugs, clutter, poor lighting, and lack of handrails on stairs. Making simple home modifications can significantly reduce your risk. Ensure you have regular vision checks And wear appropriate footwear that provides good support and traction. Don't be afraid to use assistive devices like a cane or walker if recommended by a healthcare professional. These are tools for safety and independence, not signs of weakness. It's easy to feel a bit of pride and resist admitting that moving isn't as easy as it used to be. But acknowledging changes in mobility and balance is a sign of wisdom and a commitment to staying safe and independent. Taking proactive steps to improve your strength and balance is one of the most impactful things you can do to maintain your quality of life and prevent serious injury. It's about building confidence in your body's ability to support you safely. So, we've covered 5 potential signals: unexplained weight changes, persistent fatigue, cognitive shifts, loss of interest and social withdrawal, and changes in mobility and balance. These aren't topics we always want to think about, but recognizing them as signals, not inevitable endpoints, is incredibly empowering. They are your body and mind telling you to pay attention, to investigate, and to take action. Thinking about these signs might feel heavy, but the truly surprising thing I promised you at the beginning is this: realizing these signals aren't just about decline. They are often opportunities for intervention, improvement, and maintaining a higher quality of life for longer than you might think possible. The surprising power lies in acknowledging them and taking proactive steps. Many of the underlying causes are treatable, and even when they are related to progressive conditions, early intervention and management can make a profound difference in slowing down the progression, managing symptoms, and allowing you to live more fully. The most surprising truth is how much agency you still have. You are not powerless in the face of these changes. Your actions, your willingness to speak up, to seek help, and to make adjustments in your lifestyle can significantly impact your trajectory. Remember, small changes truly can make a big difference to your health and happiness. Addressing a nutritional deficiency causing fatigue, finding effective treatment for depression, starting a simple balance exercise program, or making your home safer. These are all achievable steps that can yield significant improvements. Don't wait until a small signal becomes a crisis. Listen to your body's whispers so they don't have to turn into shouts. If you've noticed any of these signs in yourself or someone you care about, I hope this has encouraged you to take that next step. Whether it's scheduling a doctor's appointment, talking to a family member, or looking into local resources like exercise programs for seniors, I'd love to hear your thoughts and experiences. Have you or someone you know navigated these kinds of changes? What helped? Share your stories in the comments below. Your insights could be incredibly valuable to others watching. If you found this video helpful, please give it a like. It helps more people see this important information. And don't forget to subscribe to the channel and hit the notification bell so you don't miss out on future videos designed to help you live your best life at every age. Taking care of yourself, staying informed, and being proactive are the keys to navigating the years ahead with confidence and vitality. You have the power to make choices that support your health and well-being. Live your best life at every age.